Did you know that every year, over 795,000 Americans experience a stroke? That's almost one every 40 seconds. And here's the heartbreaking part: many of these strokes could be prevented if the early warning signs were recognized. What if your body could warn you weeks in advance that something's wrong? The truth is, it often does. Strokes don't discriminate. They can happen to anyone, young or old, male or female, healthy or not. But here's the good news: early detection can make all the difference. If you know what to look for and act quickly, you could save your life or the life of someone you love. In today's video, we're going to explore 7 stroke symptoms that may show up as early as 1 month before a stroke happens. These signs are often subtle and easy to overlook, but recognizing them could be life-saving. So, stay with me, and don't forget to share this video, because raising awareness could truly save lives. Number 1. Persistently elevated blood pressure. Let's talk about high blood pressure, or hypertension, and why it's such a serious warning sign when it comes to strokes. Blood pressure measures the force of your blood pushing against your artery walls. When it's consistently too high, it causes wear and tear on those arteries, much like water eroding a riverbank over time. This constant strain can weaken and narrow your blood vessels, making them more prone to blockage or rupture, both of which can lead to a stroke. Why is this dangerous? First, chronic hypertension can lead to the formation of clots that block blood flow to the brain, causing an ischemic stroke, the most common type. On the other hand, if a weakened blood vessel bursts, it results in a hemorrhagic stroke, where bleeding in the brain causes pressure and damage to surrounding tissue. Both scenarios are life-threatening, which is why managing blood pressure is so critical. How do you know if high blood pressure is silently putting you at risk? Keep an eye out for symptoms like frequent headaches, shortness of breath, or irregular heartbeats. While these might seem mild or unrelated, they could signal that your blood pressure is out of control. The good news? You can take steps today to protect your health. Regularly monitor your blood pressure, especially if you have a family history of hypertension. Simple changes, like reducing salt in your diet, managing stress through mindfulness or relaxation, and exercising regularly, can make a big difference. If lifestyle changes alone aren't enough, talk to your doctor about medications to keep your blood pressure in check. Remember, high blood pressure doesn't always show obvious symptoms, but ignoring it could put your life at risk. Number 2. Excessive fatigue. Excessive fatigue is one of those symptoms that's easy to dismiss. After all, we've all felt tired from time to time, whether from stress, a busy schedule, or poor sleep. But what if your fatigue isn't normal? What if it's your body's way of warning you about something far more serious, like a stroke? Persistent fatigue, especially when it's unexplained, can signal reduced oxygen supply to your brain. This often happens when the arteries that carry blood to the brain become narrowed or blocked. Without enough oxygen and nutrients, your brain struggles to function, leaving you feeling drained and exhausted. This type of fatigue is not just a symptom, it's a red flag. In fact, excessive fatigue is sometimes seen in the lead-up to a transient ischemic attack, TIA, also known as a mini-stroke. A TIA is a temporary blockage in blood flow to the brain, often serving as a warning for a full-blown stroke. Are you feeling exhausted even after getting a full night's rest? Do you find it hard to concentrate or stay awake, even when you're not particularly busy? These signs, especially if they're new or unusual for you, should never be ignored. The problem is that fatigue is often chalked up to lifestyle factors like stress, overwork, or lack of sleep. While those are valid causes, unexplained fatigue, especially if it's persistent, requires further investigation. Talk to your doctor or a neurologist, particularly if you have risk factors like high blood pressure, diabetes, or a family history of stroke. Remember, fatigue may feel like a small inconvenience, but it could be your body's way of saying something bigger is wrong. Don't wait, early intervention could save your life. Number 3, vision problems. Vision problems might seem like a minor inconvenience, but sudden changes in your eyesight could be an early warning sign of a stroke. Your eyes rely on a constant, healthy blood supply to function, and when the arteries supplying blood to your eyes or brain become blocked or narrowed, it can disrupt that flow. This often leads to sudden vision changes, like blurriness, double vision, or even temporary blindness. These symptoms shouldn't be ignored. They could indicate circulatory issues in the brain and may be a precursor to a stroke. Do you notice difficulty focusing, even with your glasses or contacts? Have you experienced a sudden loss of vision in one or both eyes? Maybe you've seen flashes of light or floaters that weren't there before. These changes are often caused by a lack of oxygen and nutrients reaching the optic nerve, sometimes due to an ischemic stroke, the most common type, or a transient ischemic attack, TIA. Why is this dangerous? Vision issues may seem isolated, but they're often the first visible sign of an underlying problem in the brain. If blood flow to your optic nerve is compromised, it's likely other parts of your brain could also be affected, putting you at serious risk. What should you do? Act quickly. Don't assume these symptoms will resolve on their own. Schedule an appointment with an eye doctor or neurologist immediately. If the changes are sudden and severe, seek emergency medical attention. Regular eye exams can also uncover early signs of conditions like hypertension or diabetes, which are major stroke risk factors. Remember, your eyes are not just windows to the world, they're also windows to your health. Sudden vision changes could save your life if you take action in time. Number 4, severe headache. A severe headache is something most people experience at some point, but what if the pain you're feeling is a sign of something far more dangerous? Sudden, intense headaches can be an early warning sign of a stroke, particularly a hemorrhagic stroke or a brain aneurysm. These headaches occur when increased intracranial pressure builds up due to bleeding in the brain or the rupture of a blood vessel. Is the headache the worst you've ever experienced? Does the pain seem to come out of nowhere, radiating to your neck or face? You might also notice accompanying symptoms like nausea, vomiting, or a heightened sensitivity to light. These signs are red flags, especially if they appear suddenly and without a clear cause. A hemorrhagic stroke occurs when a weakened blood vessel in the brain bursts, causing blood to leak into surrounding areas. This bleeding not only damages brain tissue but also raises pressure inside the skull, leading to intense pain. Similarly, an aneurysm, a bulging area in a blood vessel, can rupture unexpectedly, causing a sudden and catastrophic headache. Common triggers for these events include high blood pressure, which stresses the walls of blood vessels, as well as sudden physical exertion or emotional stress. These factors can cause already weakened vessels to rupture. What can you do to prevent these headaches from becoming life-threatening? Manage your blood pressure through a healthy diet, regular exercise, and prescribed medications if necessary. Avoid overexertion and learn to recognize patterns in recurring headaches. If you ever experience a sudden, severe headache unlike anything you've felt before, don't wait, seek emergency medical attention immediately. Acting quickly could save your life. Number 5, numbness or weakness in extremities. Imagine waking up one day and finding it difficult to lift your arm or noticing a sudden numbness in your leg. These symptoms might seem minor or even temporary, but they could be your body's urgent alarm that a stroke is on the horizon. Numbness or weakness in the extremities, especially on one side of the body, is one of the most critical warning signs of a transient ischemic attack, TIA, or a mini-stroke. A TIA occurs when blood flow to a part of your brain is temporarily blocked, reducing oxygen supply. This can cause sudden weakness or numbness, often affecting the face, arm, or leg on just one side of the body. It's common to notice additional symptoms like drooping of one side of the face, difficulty lifting an arm or leg, or a tingling sensation. While these symptoms may disappear within minutes or hours, they should never be ignored. Why is this so critical? TIAs don't typically cause permanent damage, but they are a major red flag. They're often called warning strokes because they indicate a high likelihood of a full-blown stroke in the near future. Unfortunately, many people dismiss these symptoms because they vanish quickly, missing the chance to take preventive action. Treat any numbness or weakness as a medical emergency. Even if the symptoms resolve on their own, seek immediate medical attention. This allows doctors to evaluate your condition, identify any underlying issues, and recommend steps to reduce your stroke risk. Early intervention can make all the difference. Don't wait for symptoms to escalate. Your quick action could save your life or prevent severe, long-term disability. Always take these signs seriously. Number 6. Speech problems. Imagine trying to speak, but the words don't come out right. You can't form coherent sentences, or maybe you can't understand what someone else is saying. These difficulties, often sudden and unexpected, can be a key warning sign of a stroke. Speech problems, such as slurred speech or trouble expressing yourself, occur when the brain's language centers are affected by reduced blood flow or damage caused by a clot or bleeding. Are you struggling to find the right words? Is your speech slurred or garbled, making it hard for others to understand you? Do you feel like you know what you want to say, but just can't articulate it? These are classic indicators of aphasia, which is the inability to understand or express speech, often caused by a stroke. Why do these symptoms happen? When blood flow to areas of the brain responsible for language is blocked or interrupted, those regions can't function properly. This is common in both ischemic strokes, caused by clots, and hemorrhagic strokes, caused by bleeding. Why are speech problems often ignored? Because they can be intermittent or subtle. A person might think they're just tired or flustered, and by the time the symptoms fade, they dismiss it entirely. But ignoring these signs can lead to devastating consequences. Follow the FAST method: face drooping, arm weakness, speech difficulty, time to call 911. Even if speech issues resolve quickly, they could indicate a transient ischemic attack, TIA, or mini-stroke. Seek immediate medical attention to identify the underlying cause and reduce the risk of a full-blown stroke. Speech problems are never just nothing. Acting quickly could mean the difference between recovery and permanent damage, or even saving a life. Number 7. Neurological issues. Sudden neurological changes, such as memory loss, dizziness, or balance problems, are not just signs of aging or minor inconveniences, they can be early indicators of a stroke. These symptoms occur when blood flow to the brain's areas responsible for balance, coordination, or memory is disrupted. Even mild changes in your ability to walk, think clearly, or stay steady on your feet could signal serious neurological distress. Pay attention to difficulty walking or standing, frequent falls, or a sudden sense of clumsiness that's out of the ordinary. You might also notice sudden confusion or forgetfulness, where even simple tasks become challenging. In more severe cases, these symptoms can be accompanied by nausea, vomiting, or a spinning sensation, especially in hemorrhagic strokes, where bleeding increases pressure on the brain. Strokes disrupt blood flow to critical brain areas, leading to loss of function. For example, if the cerebellum, the brain's balance center, is affected, it can cause dizziness, coordination issues, and instability. Similarly, reduced blood flow to the memory centers in the brain, like the hippocampus, can lead to confusion or forgetfulness. These symptoms are often dismissed as fatigue, dehydration, or even anxiety. But neurological changes, especially when they occur suddenly, are serious and warrant immediate medical attention. They could indicate a transient ischemic attack, TIA, or the early stages of a stroke. If you or someone you know experiences these symptoms, don't wait for them to go away. Seek emergency medical care, even if the symptoms seem minor. Early evaluation can identify the underlying cause and potentially prevent permanent damage or a life-threatening stroke. Your quick action could save a life or a lifetime of independence. Understanding stroke types and causes. Strokes are medical emergencies that occur when the blood supply to the brain is interrupted. They are broadly categorized into two main types: ischemic strokes and hemorrhagic strokes. Understanding the differences and their causes is crucial for prevention and timely treatment. Ischemic stroke. This type accounts for 85% of all strokes and occurs when a blood clot or arterial plaque blocks blood flow to the brain. Without oxygen and nutrients, brain cells begin to die within minutes, causing irreversible damage. The blockage is often due to conditions like atherosclerosis, where plaque buildup in arteries narrows the passageways, or atrial fibrillation, an irregular heart rhythm that can cause clots to form and travel to the brain. Hemorrhagic stroke. Far less common, but often more deadly, hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing bleeding that damages surrounding brain tissue. This type of stroke is frequently caused by uncontrolled high blood pressure, brain aneurysms, or head trauma. The bleeding increases pressure inside the skull, further exacerbating brain damage. Common risk factors. Both types of strokes share overlapping risk factors. Atrial fibrillation, AFib. This irregular heart rhythm increases the likelihood of clot formation. High cholesterol contributes to plaque buildup in arteries, leading to blockages. Smoking damages blood vessels and accelerates arterial plaque formation. Diabetes increases the risk of vascular damage and clotting. Understanding these types and their causes can help identify the steps needed for prevention, such as managing blood pressure, controlling cholesterol, quitting smoking, and monitoring heart health. Recognizing the symptoms and acting quickly, whether it's a blockage or bleeding, is critical to reducing the damage and saving lives. Always take stroke symptoms seriously, no matter how minor they seem. Stroke prevention tips. Preventing a stroke is often about taking control of your overall health. Small, consistent changes in your lifestyle can significantly reduce your risk. Here's how you can take proactive steps to protect yourself. Control blood pressure and blood sugar. High blood pressure is the leading cause of strokes, while uncontrolled blood sugar from diabetes damages blood vessels, increasing the likelihood of clots or ruptures. Regularly monitor these levels and work with your doctor to manage them effectively through medication, lifestyle adjustments, or both. Maintain a healthy weight. Excess weight increases your risk of high blood pressure, diabetes, and high cholesterol, all major stroke contributors. Aim to exercise at least 150 minutes per week, incorporating both cardio and strength training activities. Even brisk walking or yoga can make a big difference. Eat a healthy diet. What you eat plays a critical role in stroke prevention. Focus on fresh, unprocessed foods, such as vegetables, fruits, whole grains, and lean proteins. Avoid sugar, saturated fats, and excessive alcohol, which can raise cholesterol levels and blood pressure. Consider adopting a heart-healthy diet, like the DASH or Mediterranean diet. Quit smoking and reduce stress. Smoking damages blood vessels, promotes clot formation, and accelerates arterial plaque buildup. Quitting smoking is one of the most impactful changes you can make. Additionally, manage stress with techniques like mindfulness, deep breathing, or meditation, as chronic stress can elevate blood pressure. Sleep well and stay proactive. Sleep is essential for cardiovascular health. Aim for 7 to 9 hours of quality sleep each night. Stay proactive by scheduling regular checkups with your doctor to monitor blood pressure, cholesterol, and other risk factors. These preventive measures ensure that potential issues are addressed early. Your health's in your hands. Taking these steps now can reduce your stroke risk and lead to a longer, healthier life. Strokes are serious, but they're also preventable if you know the warning signs and take action quickly. If you or someone you know experiences symptoms like sudden numbness, vision changes, speech difficulties, or severe headaches, don't wait, seek medical attention immediately. Acting fast can save lives and prevent long-term damage. We'd love to hear from you. Have you or a loved one experienced any of these symptoms? Do you have questions about stroke prevention? Share your thoughts in the comments below, and let's start a conversation that could help others. If you found this video helpful, don't forget to like, subscribe, and share it with your friends and family. Together, we can raise awareness and make a difference. Thank you for watching, and take care of your health.